Tanse Anin. My name is Cadmus Delorme. I'm Chief of the Cowessess First Nation. This message is for Cowessess First Nation citizens, community members, staff, and friends of Cowessess First Nation. We are currently in the midst of COVID-19. The health officials have indicated that it has not even hit its peak as of yet, and it is only the middle of March. I just want to assure you that Cowessess First Nation is remaining proactive in this state that we're in. We cannot let fear and worry make our decisions for us. Chief and Council, Executive Office, and some staff members have already started to plan on the long run. We are currently in the process of purchasing sanitization material to deliver to our 237 homes, to our homes that are in the treaty land entitlement land areas, and as well as to deliver out of the Regina Urban Office. One of the things about Cowessess First Nation is we visit, we're communal. In this COVID-19 situation, we're asking people to start to settle in their homes for a few weeks, just to understand what the situation is. Our main objective is to keep the home community from COVID-19. We are starting to shut down our public areas, our schools, and whatnot. Some people depend on our schools. We have children that have their best meals at school. We have children that are emotionally connected to their teachers, to their friends. And so we're just kind of giving it a last few days for everybody to kind of teach each other what it means to actually stay at home and to resist from traveling. On Friday, March the 20th, that is when services will start to cut down. The CCEC school, the ABE, the Cowessess daycare, students will be going to schools there. Staff will still be asked to attend if they meet the 5 following requirements. If any staff have traveled to a city that has a case of COVID-19, they'll be asked to stay home. If staff live in a town or city that have a case of COVID-19, they'll be asked to stay home. If staff are over the age of 65 or they have an immune system that is susceptible to COVID-19, they'll be asked to stay home. And lastly, parents or guardians who have children who are dependent on our services and are no longer there have the option to stay home. Cowessess First Nation wants to make sure that our essential services continue. We have water delivery, garbage pickup. There are seniors and others that need the health services. The main objective in this moment of truth is reducing the way that germs travel to one another. And so that is why we are in social distancing at the moment. In Cowessess First Nation, our values are to shake hands, to hug one another. Right now we have to kind of keep a little distance, so we got to pull out the lip pointing again and the ways that we communicate without touching each other. The elbow bumps and whatnot. We still want to acknowledge one another. When it comes to supplies, there is a panic across this country right now with purchasing supplies. Cowessess First Nation is in the midst of finalizing supplies to make sure that we don't go without. We have Cowessess Gas and Grocery 1, which is fully stocked. We have our 4C Farms, which is Black Angus cattle. So we're going to continue those as businesses. But if it ever comes to the moment of truth where food security, Cowessess does have extreme measures and within our emergency plan to make sure that we don't go without. But in this moment, we just must make sure that fear doesn't drive us. We are smart, intelligent, good-looking people, and we must continue to stay united in this time. And on behalf of the Council, I just want to let you know that we are going to continue to work day in and day out to make sure that we stay proactive and that the Cowessess First Nation continues to thrive to be the best nation that we can be. The Naskaman.
This is what you can do to prevent COVID-19. Wash your hands with soap and water. If it's not available, then use an alcohol-based hand sanitizer. Avoid touching your eyes, your nose, your face with unwashed hands. Avoid close contact with people who are ill. If you are ill, stay home. Sneeze and cough into your sleeve. If you use a Kleenex, dispose of it immediately. Clean and sanitize frequently touched surfaces like doorknobs with a disinfectant that will be delivered to your home. If you have to travel to go shopping or to go to a medical appointment in Regina or Saskatoon, follow the steps that I've mentioned. When speaking with people, keep a distance of at least 3 feet or more and do not hug or shake hands. If you are worried about yourself or a family member, ask yourself the following questions. Have you traveled or had contact with someone that has COVID-19? If you have no symptoms, isolate yourself at home for 2 weeks. If you have a fever and a severe cough but have not traveled outside Canada or had contact with someone that has COVID-19, seek medical attention as you normally would for the same symptoms. If you have a fever and a severe cough and you have traveled outside Canada or had contact with a COVID-19 case in the last 2 weeks, please call 811 to arrange for testing. Cowessess First Nation has a communicable disease emergency plan, and as it becomes necessary, it is being implemented as required. However, the risk to the nation remains low. Updates will continue to be provided as they become available to us. For additional information, there is information on the Health Department Facebook page, the Cowessess Facebook page, and the Cowessess website. And it will also be distributed with the cleaning supplies later this week. Wash your hands, stay safe.